Thank you, doctors. So, without delay, let's start the inaugural session. I invite Dr. Jagadi, convener, National Women's Wing, to deliver the welcome speech and kickstart this enlightening session. Dr. Jagadi, please.
Thank you, Dr. Surabhi. Good evening, doctors. Dr. Halloween Koile, National Chairperson of IHMA Women's Wing, Dr. Prabhugiran, National President of IHMA, Dr. Maya Rani Senan, National Vice President and Women's Wing in charge of IHMA, our esteemed faculty, Dr. Rekha Srinivasan, and my dear colleagues and friends. We are thrilled to have such a knowledgeable and enthusiastic audience joining us from various parts of the country and also from UAE. It's a pleasure to welcome you all today for the first session of Women and Child Health webinar series conducted by ISMA National Women's Week. Over the next three sessions, we'll be exploring the topic role of a homeopath in managing autism spectrum disorders with the goal of helping us to understand the topic in depth. We have Dr. Halloween Coelho, National Chairperson of IHMA Women's Wing, today with us to preside over the formal inaugural section. I welcome Dr. Halloween to the meeting. Dr. Prabhugiran, National President of IHMA, has graced us with his support and presence by agreeing to inaugurate the webinar series. Sir, we, the Women's Wing of IHMA, extend a warm welcome to you. Dr. Maya Rani Senan, National Vice President of IHMA, is here with us to make the keynote address for the meeting. I take this opportunity to welcome you to meeting, Doctor. We are excited to learn from our esteemed speaker, Dr. Rekha Srinivasan, who will be sharing her vast experience and knowledge on the topic of autism spectrum disorders. On behalf of IHMA Women's Wing, I welcome you to the webinar series. All our colleagues are looking forward to learning from you. We, Dr. Jolie Dimilo, Coordinator, Women's Wing IHMA Karnataka State Chapter with us, who has agreed to deliver Notebook of Text. I extend warm welcome to you too, Doctor. My dear colleagues and friends, your presence here is a testament to your commitment to continuous learning and professional development. We are thrilled to have you as part of this journey. From IHMA Women's Wing, I welcome you all to this session of great learning. We are confident that this webinar series will be an enriching and insightful experience for everyone. Thank you once again for joining us.
Nothing is more warm than a warm welcome, right? So, thank you, Dr. Jagdi, for your warm welcome. Next, moving on to the presidential address, for which I kindly invite Dr. Halloween Coelho, IHMA National Women's Wing Chairperson. Ma'am, on to you.
Ma'am, you need to unmute.
Thank you, Dr. Surabhi. I'm happy to be here as the chairperson of the Women's Wing of IHMA National, and I try to do my best for this year for all of you women doctors and all of IHMA. Good evening, doctors. I'm Dr. Halloween Coelho, and I practice in Dubai and belong to the UAE chapter of IHME. We have tried to delineate and plan some interesting topics for this year. Let's have a balance of both knowledge as well as entertainment. So the first half for the month of September, October, and November, we have planned something that is knowledge updating, and we'll take a break in December, and then from start afresh in January for discovering the talents of our many women doctors. So we are delighted to have Dr. Rekha Srinivasan starting the webinar series for the month of November. She's an experienced homeopath brimming with enthusiasm. We are grateful to her for sharing her knowledge on the treatment of autism spectrum disorder with homeopathy. In the month of October, we have another eminent homeopath, Dr. Anupa Rani, sharing her knowledge on learning disabilities. 4 of her webinar series will bring us up to date. November webinar series will have Dr. Salini speaking on developmental disorders and understanding the treatment of ADHD with homeopathy. Latter part of November will cover the essential topic of women's health. Adolescence to 40 years in the first part, and the second part covers menopause and beyond. And these 2 webinars will be done by our eminent Dr. Kushali Gambhir. Now, I just wanted to suggest something to revitalize our chapters. Each of our chapters, I think, should be enthused to have a lot of interaction. That's how we women can go to the next level. And I would love to reiterate what Dr. Surabhi said, that our aim is to empower women folk, both in the professional and family setting, to manage effectively, to encourage lady doctors in social activities, and provide a platform to seek guidance and support in professional and domestic issues. Now, for that, how can we put this in action? It is only by interaction in our chapter activities. We in our UAE chapter have been enthused by our president, Dr. Neetu Nicholas, to have every week in the August, we had August escapes, and we had a posting about our pet, our talents, and about our practice and our cooking. So that way we can use all facets of our lives, and we can interact and create a bonding experience. I would also like to say that we can have these activities in each chapter initially, that is starting from September, and then post it in the main group so that all of us know about each other and our talents, which may be by way of art, crafts, song, dance, poetry, storytelling, and dreams. I so sincerely hope that all of you would love to participate in this bonding exercise so that we make the full use and build the excitement and have a lot of interesting posts on a daily basis in our women's wing. Let not the distance between us make us distant. I wish to thank my team members who were most helpful and supportive. My sincere thanks go out to the President, primarily Dr. Prabhu Kiran, and to the Vice President, Dr. Maya Rani, who was very encouraging. And the pillar of strength was Dr. Lata and Dr. Jagati, who has organized this webinar meticulously. My grateful thanks to Dr. Saji for being so tolerant and helping us out every step of the way. Thank you, doctors. And finally, to each one of you doctors for attending it in huge numbers. To see 312 signing up for the WhatsApp group is a real thrill. I've been following it up on an early basis to see how it is building up. Thank you. Thank you so much. And knowledge in action is true wisdom. Thank you, Dr. Rekha Srinivasan, for sharing your wisdom willingly and enthusiastically. Truly appreciate your initiative. All the very best. Thank you.
Thank you so much, Dr. Coelho. That was really inspiring. Now, moving on to the inauguration session of ours today, for which I call upon Dr. Maya Rani Senan, National Vice President of IHMA. She'll also be dealing with a keynote address for the day. I kindly invite you, ma'am.
Thank you, Doctor. Am I audible?
Yes, ma'am, you are.
Okay. Respected National Women's Wing Chairperson, Dr. Halloween Coelho, Convener, Dr. Jagdi, Dr. Lata, today's faculty, my dear Dr. Rekha Srinivasan, other national and state officials, and dear homeopaths, good evening. It's a privilege to speak today on a subject that touches countless lives, autism spectrum disorder. We know that it's a neurodivergent disorder which has a spectrum of pictures like presentations, like communication problems, social challenges, repetitive behaviors. But we should also keep in mind that this is also a journey that demands patience, resilience, and compassionate care. We are now witnessing a lot of homeopaths like Dr. Rekha, Anupa, many doctors, Dr. Vinod Joseph. We are now witnessing them successfully dealing with such cases because homeopathy looks beyond the label or the diagnostic criteria and takes into consideration the altered state which can be brought back to a positively functioning individual. That is our role as homeopaths. With careful case taking and individualized remedies, homeopaths can support children in communication, adaptability, in short, like giving hope where the options are very limited. The informative sessions like this are very helpful to us doctors who are interested in treating such cases and providing a holistic improvement. Actually, IHMA Women's Wing stands committed to empowering women doctors to lead in this area by creating opportunities for training, collaboration, knowledge sharing. We are actually preparing ourselves to be proficient, confident, and compassionate physicians for children with autism. I really appreciate the Women's Wing team for taking up this topic for discussion. Let's remember that the role of a physician is to heal by removing the obstacles to the child's inner expressions of health. We also know that when homeopathy is practiced with sensitivity, the children find more opportunities and possibilities. Together, let's pledge to refine our skills and extend unwavering support to every family touched by autism. With these few words, I declare this webinar, the first webinar in this series, to be inaugurated. All the best, and thanks for a patient listening. Thank you very much.
Thank you, Doctor. Now, moving on to the vote of thanks, for which I call upon Dr. Jolly D. Mello, Women's Wing Coordinator of IHMA Karnataka State Chapter. Doctor, on to you.
Gratitude is the fairest blossom that springs from the soul. A pleasant evening to one and all. I deem it my privilege, on behalf of IHMA National Women's Wing, to propose the vote of thanks. First and foremost, we express profound gratitude to the Almighty, whose benevolent blessings have illuminated our path, strengthened our efforts, and made this event possible. I extend a special word of appreciation to Dr. Mayarani Senan, National Vice President, for delivering a thought provoking keynote address that has set the tone for today's deliberations. And Doctor has also inaugurated this session. Thank you, Doctor. Our sincere thanks to Dr. Halloween Coelho, Chairperson, IHB National Women's Wing, for the insightful presidential address which has motivated and added immense value to this session. We are deeply grateful to Dr. Jagati Muralidharan, convener of IHMA National Women's Wing, for a warm words of welcome that gave this program a gracious and befitting start. A sincere gratitude to Dr. Rekha Srinivasan, who will enlighten us on the role of homeopath in treating autism spectrum. Her insights and expertise are sure to enrich today's session. Heartfelt word of gratitude to the members of IHMA National Women's Wing for their dedication and effort in organizing this webinar. Their vision and initiative have truly been the driving force making this event possible. I extend my heartfelt thanks to all the distinguished members, esteemed colleagues, and participants who have joined us today. Your presence and support will make this webinar truly meaningful and memorable. A special word of appreciation goes to our Masters of Ceremony, Dr. Surabhi and Dr. Nikita, for steering today's webinar with warmth, elegance, and flawless coordination. With gratitude in our hearts, we look forward to many more such occasions of learning, sharing, and growing together. May the knowledge and inspiration gained today continue to guide us in our journey, and may our collective efforts lead to greater achievements in the day to come. Thank you.
Thank you so much, Dr. Jolly. Now, for the introduction of our faculty, I call upon Dr. Nikita, IHMA Kerala, who will be handling the role of host from now on. And till bearing me, Dr. Surabhi, for a short host session was really pleasurable for me. And I hope I never made anyone get bored with my hosting. Thank you for bearing me again. On to you, Dr. Nikita. Thank you.
Good evening, everyone. It's my great pleasure to introduce our faculty, Dr. Rekha Karnam Srinivasan, a renowned homeopathic expert with more than 2 decades of rich clinical experience. Dr. Rekha Srinivasan's impressive credential includes BHMS, a fellowship in homeopathy psychiatry from UK, a diploma in community mental health from NIMHANS, advanced training at IACH Greece, and a fellowship in palliative care IWHB. She currently serves as Vice President of IWHB Tamil Nadu. She is a seasoned orator and a writer with over 30 published articles, a medical blogger, teacher, and developer of innovative tools and questionnaire for COVID-19 and telemedicine in homeopathy. Her contributions include serving as former Vice President, IWHB Bangalore Chapter, former Director for IHRC IHMA, and former Associate Editor of Homeopathic Medical Panorama. She is also an active faculty member for national and international conferences, including NAPCAIM, and a mentor for workshops on cancer care and autism spectrum disorders as a part of Iconic Women Homeopaths. Currently, she is the editor in chief of the upcoming book, Essential in Taste Approach and Management of ASD with Homeopathy. We are truly honored to have Dr. Rekha Srinivasan with us today, and we are eagerly look forward to her for sharing her expertise and insights. So I welcome you, ma'am, and it's all to you.
Thank you so much, Dr. Nikita, for the wonderful introduction. I hope I am audible.
Yes, ma'am.
Yes. I take 2 minutes to express my gratitude and uh, especially to IHMA. I'm indebted to IHMA for everything what I am today, apart from clinician. I was a clinician till then, till 2015, and then I turned into organizer uh, and editor, and then also I became a mentor and whatnot. And I was introduced to all these things and as well as Malayalam when I joined IHMA. And I know the word Chechi, and that stands only for my Maya Radi Chechi, because I know that only Chechi has been a full support, and she has mentored me like anything. Thank you, Chechi. You are here. That's very heartening for me. And then I encountered many doctors in my almost 10 years of this IHMA association, and I have learned so much from each of them, and it has been such an enriching experience to be associated with IHMA in any way. Every single encounter has been a very enriching experience, and now I am honored of I have been turned a speaker as well through IHMA alone. So it has been everything for me, and I am very happy to be again in the speaker chair today, because it means so much for a downtown practitioner. Uh, all of my dreams have come true through association with IHMA. I'm really indebted to IHMA. Thank you so much. And now I want to talk about my uh, topic today. So uh, I want this to be a dialogue and interaction between doctors rather than a one-sided. I'm telling you, and you have to hear such type of thing. I had posted a poll in the group, and the response has been overwhelming, and I'm so happy that so many doctors took time to vote in the poll. So now we'll start the session with my little bit knowledge, what I have gathered while editing the book on autism, and it has been very helpful for me in my clinical practice. Hope we can come out of the book as soon as possible. And now I urge doctors to make it homeopathic choice therapy. That is, it means the doctor and the patient, both of us consciously seek holistic health improvement. The point is, as a patient or coming to us when all the doors have been closed. That is the most of the times, or almost by default, we can say so many times. Yeah, it differs from geographic, it depends in many parts of our country, or but most probably that is the case where they, especially in autism cases, and we doctors, instead of being just taking the case and prescribing and the symptoms we are getting through, we have to be preserver of health, as mentioned by Hahnemann. So we are taking no chance. We are leaving no stone unturned to achieve the optimal health of the child, as well as the parents or the caregiver, because we all are aware of the gravity of having a autism diagnosed kid at home. Uh, so that is the point here. So that's why I have put the heading as homeopath's role in treating autism spectrum disorder rather than help of homeopathy, which can be given to autism spectrum child. Because the difference is homeopathy is such a wonderful, and I can say that is the only thing which can bring about lost things and very curative effects in a autism diagnosed kid. But the sad part is we homeopaths have such a wonderful results with homeopathy, but we haven't showcased it in such a way that the world takes notice. So we have been providing in our own way, in our clinics, in our setups. We haven't come out with the amazing results we have achieved. The each single night sleep the mother gets, the each single pot which has been saved, everything matters, isn't it? So if a child is running around and is not eating at proper time, and he is asking for food at 3 a.m., banging the door, this has been stopped. Isn't it such an amazing thing? But we haven't showcased it in such a way. We homeopath. not showcased in such a way that the world takes notice of it and it seeks actively to include homeopathy in their treatment choices. They have been, it's a firefighting mode, or it is an ad hoc, like uh, they are not getting anything. So okay, let's try even homeopathy. Why not? In that way. So we have to change the mindset. We have to change their perspective. We have to change their attitude towards homeopathy. And that is why I have been asking you to participate and tell your opinions and your ideas about uh, treatment of ASD, and we will have some voice over this subject. And that's why it should be a dialogue rather than a one way of talking. So in this seminar series of three, I want to talk about, today I am going to talk about early detection and before 5 age cases. And next, I will be planning about teens and adult ASD management. And I will be talking about what can be improved, what can be cured, a framework for young homeopaths, and then do's and don'ts during treatment, and role of diet and regime. This will be the outlook of my webinar series. So, what is the need for the early detection, isn't it? Why it should be early detection? Why can't it be like whenever it comes to us, we can treat them, right? No, that is very important because even researchers are looking for early signs in preschoolers uh, below the age of 5, because then only they can, because it is usually typically diagnosed at 5.5 years and as per their group 11 years. So if it is early identification, we can have in a homeopathic perspective, we can have curative aspects. We can cure the cases usually. And what are the clues? We are today. I will be talking about all these things, and also case vignettes I will be sharing, and you tell me
Yeah.
your opinion. Pardon, doctor. Pardon. Uh, should I be little slow?
No, ma'am, you can continue.
Okay. Yeah. So, what are the clues here in when we are seeing a child, maybe of 1 year, 2 year, or a toddler, or below 5 years of age? Usually, we can think about autism spectrum when we are talking about these things, especially milestone achievement, physical, emotional, social, linguistic, or behavioral milestone. And also, there are regressions, if any. Autism spectrum symptoms are evident in the first few years. So it can be tested with social responsiveness scales, which is designed for 2 to 4.5 years. These things are available online, or I can share the questionnaire. And I have also uh, we during the IHRC compiling the book, we have developed uh, a comprehensive case taking format, and for ASD kids. If you are in need of it, you just message me. I can send the link. And there are also a few other screening tools where social communication questionnaire, childhood autism spectrum test, this is CAST, it is very helpful, and also ASSQ, and uh, for infants, it is STAT and MCHAT, modified CHAT. So why we need all these scales? Because if we work with scales, then only we can show the world that before and after scenario, and that we can come up with cohort studies, or we can have multiple center-based studies, research studies, which will enhance the credibility of including homeopathy in autism spectrum treatment. And interestingly, when I conducted that previously, I was mentoring almost one month of a webinar series, everyday webinar series with many prominent homeopaths who are working in this field. And you will be amazed, astonished by the number of cases they are seeing and how they are helping them out. And 5,000 plus cases have been seen by few doctors who are working in the public sector, like and
And last
NIPMED.
slide, please.
Last, uh, you want it? Yeah. So they are coming up with so much excellent results. And the thing is, they have before and after. Uh,
Thank you, ma'am.
uh, Even they have assessments before the treatment and after the treatment as well. So that means we are not showcasing it in the proper way, isn't it? So that's why I was very keen on making this a dialogue where homeopaths are participating and they are coming up with their own views about the treatment of autism kids. And when it comes to assessment factors, cognitive level has to be assessed, language ability, communication skill, social skill, and play, and repetitive or other abnormal behaviors has to be noted. Stage of social development in relation to age, mental age, and stage of language development. And all these things has been assessed in those uh, government run institutions like NIPMED, where these doctors are coming up with amazing results. So, isn't it wonderful that homeopathy can be uh, put forward with research uh, basis, and we can say autism can be helped with homeopathy. So, I'm very keen on that. And how to use uh, exploratory feature analysis. This is a research part actually. So repetitive motor behaviors like stimming, they are doing repetitive behaviors, insistence on sameness, and circumscribed interest, and rigid routines and rituals, which is the hallmark sign of autism. So these things we can see in our own clinics. So if we are, as they say, we only see the things what we are oriented to see, isn't it? We don't see what our mind don't has not seen. So that's why I'm orienting to all these things. So this RMB is found associated with IQ, age, social communication impairment, and also presence of regression. So the RMB is repetitive motor behaviors like stimming or running around or circling, those things. And IS is they're very rigid. They don't come out of the house, or they will be in certain place, one corner. They will only sit there. They will have certain rigid ways of doing things. And CI is they are accustomed to the very rigid things and routines. And the corner of the photograph has to be in the perfect place in those things. That is in CI. So all children engage in repetitive behavior as infants and preschoolers. Yeah, we should know the difference, right? If a small kid comes and he will be doing the same thing. If you give him some new thing, he'll be playing with the same thing for a few days, 3 days, 5 days, 10 days. But that is not a feature of autism. So we should be oriented to know what is the difference between a neurotypical child and uh, probably a autism child. And repetitive behavior helps that helps in the motor skill. But when it becomes small adaptive and increased frequency duration and impairs their daily life. So that's when we see that it is not helping. Yeah. And then these are the ASD categories. What this is from my notes. I have made it in this way. So these are all genetic causes. Usually we will not be knowing genetic causes, but if a child comes with the reports where they have family history of some genetic disorder, we can guess that child may probably develop spectrum disorder, or they may have some psychiatric issues in future. So that's why we have to know the certain very common genetic disorders which are associated with autism spectrum and genetic morbidities like Fragile X syndrome or tuberous sclerosis. These are all rare conditions, but in our clinic, we can get some clues. For example, in Fragile X syndrome, boys are more affected and they eat without any endlessly they will be eating and they will be passing motion. And this type of behavior, when we see in the kids who have other features as like not just that one. Few kids have that excessive eating habit. That is not a problem. But they have other features as well. So we can have a thought that they may develop into autism spectrum kid. And Rett syndrome, that is in girls. That is a genetic disorder. Uh, I will tell a case witness at this point of time so that you can guess. Uh, I hope that will be okay for you. It's a child of 2.5 years. When she came to me, she was non-verbal. She was not even uttering one word. She was very restless, cranky, and always on the move. And she has no eye contact, zero eye contact. But she had 1 month of high fever, 103 to 104 fever, and she was hospitalized just before she came to me. She was brought to me. And till then, till 2 years, like just before 1 month of fever, she has achieved all the milestones normally. Mm, and what do you guess? After the high fever, what could be her milestone? Any suggestions in the chat box? Uh,
No, ma'am.
please put in chat box. I will. That will be helpful for interaction. So, what do you think? Her milestones will be normal now, or it is regress? I think you may have uh, guessed it right. Yeah, her milestones have regressed, and then uh, yeah, yes, regress. So her milestones were regressed, and she was cranky. And there is no eye contact, and then you can understand that was she had encephalitis, and that's why she was hospitalized. After this, after with homeopathic remedies, especially he got better with Cicuta virosa. You know that Cicuta virosa is for high fever as well as toxic fever and also post vaccination. Also, it covers those things and also head injury. But in this case, I had prescribed for her toxic fever, and she got better with that. And she had even she needed a MAC carb because she had a green stool. Okay, that lasted for almost 1 week, and it didn't come under control with any medication. So if it is not coming under control with any medication, allopathic or homeopathic, what is your inference, doctor? What do you think would be the reason? Any suggestions? Why there is no control of loose motion? Yeah. Let me tell you, when healing process is going on, it is like a snowball rolling down. So that I have seen in my cases, and it has been told by one doctor, our Reverend Dr. Praful Vijayakar sir. After that only I noticed that more. It is like a snowball running downwards. So nothing can stop it if it is a healing crisis. And even homeopathy, allopathy, whatever. So she passed the green stools for almost 1 week. After that, she started achieving her milestone. She had repetitive fevers of 100, 101 in that month actually. And after that, she started talking. She started singing rhymes. By the time or it was almost 1 year of duration, uh, she was school ready. She was singing rhymes. She was dancing. Uncut was little improved than before. Everything was achieved. So, what do you think? This is it not? It's a feat of homeopathy that she was almost cured with homeopathy, isn't it? Uh, you agree to this, right? Yeah, please put in the chat box. Do you agree? Yes, but the thing is, they moved to USA. She was given all the vaccination. I don't know how much they gave, maybe 50 or 60. And then, can you imagine what happened after that? She can talk, but she is not in a normal school. She has tantrum issues. She beats her mother, pinches her mother. She has trichotillomania now. Now she is now 12 years old and severe behavioral problems. So, what is your inference here? I see. Yes. Okay. Yes. After vaccination, request. And uh, I see this as Rex syndrome. Why? Because she had that potential of getting the problem. She was cured with homeopathy, no doubt, but it didn't continue after the assault of vaccination, right? And now, even with homeopathy, we couldn't make her uh, near normal as she was before she got the vaccination. So here I see there could be some genetic focus, and which is why she is, even though she achieved so much of improvement with homeopathic treatment, she couldn't sustain that when there is a huge assault on her on her homeostasis, isn't it? So uh, these are the ways we can understand that there could be some genetic focus or something deeper pathological issues when there is no improvement with our treatment. And this is to do with the poll which I have already posted. So we will discuss about the uh, whatever has been posted in the poll. We'll discuss about that in the end. And then these are all the inheritance patterns. So if there is any family history of very deeper pathological cases and any
Excuse,
uncles or aunts having
yes,
psychiatric illnesses,
ma'am. Hello, ma'am. Yeah, in
yeah,
the
yeah,
chat box, there is a query. Was she treated after the vaccination homeopathically about that case?
yes, yes, she is on treatment even recently till 6 months back. Even after they moved to USA, she is on homeopathic treatment, but it has been a very very difficult to manage her. Very difficult. Yes, and then here usually I will take up the questions in the end, but this was relevant, so I answered. Yes, and then inheritance pattern. Uh, so these are all clues for the child may be getting into the spectrum disorder. So, what are the clinical attributes and replication of phenotypical classes? So, this is new set of researchers coming up with phenotypes, 4 phenotypes in autism spectrum disorder kids. So, this is based on the genetic orientation, and they have made it in 4 categories where there is social and behavioral challenges. They show core autism traits like stemming those things, including social challenges and repetitive behaviors. Reach developmental milestone at a pace similar to children without autism. That is, like they look like neurotypical and often experience co-occurring conditions like ADHD, anxiety, depression, OCD, along with autism. So this social and behavioral charges autism trait. What do you think? It is homeopathical suitable or very difficult to treat? What is your opinion? Please tell me in the chat box. Yeah, please. What do you think this type of cases? Yeah, and then I will move on. You just put in the chat box what is your thoughts. Social and behavioral charge. So they are neurotypical. They are achieving milestones like neurotypical uh, uh, kids and mixed ASD with developmental delay. Here they have developmental delay and then they have very severe symptoms later than children. Usually does not show signs of anxiety, depression, disruptive behavior. Mixed refers to difference between groups with respect to repetitive behaviors and social challenges. Like these are milder versions. They are not showing up like ADHD, anxiety, and those tantrums and hangama. There is no tantrums and hangama much in this group. And this moderate challenges show core autism related behaviors but less strongly than those in other groups. Usually reach developmental milestone on a similar track to those without autism. Generally do not experience co-occurring conditions. So what is this moderate challenges? Yeah. And then this is the broadly affected, face more extreme and wide-ranging challenges, including developmental delays, social and communication difficulty, repetitive behavior, co-occurring psychiatric conditions like anxiety, depression, mood dysregulation. So these are all. So now you can understand, no, what could be the uh, outcome. So uh, not much interaction here can be altered. Yes. So I think based on these uh, phenotypes, social and behavioral challenges, this group is much amicably helped with homeopathy, but we may have to have other, we have to take help from other faculties like other modules, and then we may achieve some optimal results in these social and behavioral challenges group. Mixed ASD, they can be helped to much extent. But as I told, in those cases, even IQ usually psychologists say that is cannot be altered at any point of time. It is once in a lifetime IQ. But we have seen in our cases where IQ has been improved, and even I saw that case. One another doctor had posted, so it was around 70 IQ, and that child developed to 93 or something IQ after post homeopathic treatment. That's amazing, right? So mix the ASD with developmental delay. I think we can help them a lot, but making them near normalcy depends on each case. We can't be sure about all the cases. Of course, everything is individualistic, whether it is homeopathy or even autism spectrum disorder. There is no, they say there is no autism spectrum disorder. There's only one child, and he is affected with autism. So each child is unique, and you can't compare with one child with another. So in that way, yeah, that is agreed. But I think these two categories, homeopathy can help them a lot. And these moderate challenges cases, these are all the cases, I guess, the single therapy cases which are cured cases, or who are near normal, or who does not go back to original state even after much of assault or great turmoils in their lifetime. So I will share another case with Nick. Uh, I will make it a little later. I will tell in the brief. Sorry for that. I have not been giving you cases in a whole length. I am not giving the, because this is a public platform and I can't be revealing about my cases. And now I am only giving the outline of the case so that it will help you to think about those cases which you are getting in your clinic, whether what can be done for this. How can I help them? Though you have to take case everything else is same. So it gives little bit of uh, clarity to you when you approach that such cases in your clinics. And I had one case. He's 4 years when they came to me. He was moderately affected, and his IQ was no. Then they had done IQ testing. He was diagnosed as pervasive developmental disorder with all the milestones were achieved normally, but he was non-verbal. He could speak only one or two words, and he had come to behavioral challenges. He was very cranky, very adamant, and he will be throwing things, all those things, and he will not eat even single grain of rice. Okay, he will stay hungry for whole day, and his mother has to open his mouth and pour the porridge into his mouth. It was such a big thing, and he needs his father always. If his father is out of station, gone, and after and he's a very clever boy as well. And then I started with uh, tarantula. It helped him a lot, and then he had fever. Belladonna helped him a lot for his violent anger. And then uh, within 6 months, he started singing rhymes. He can speak in Hindi, Tamil, as well as his mother tongue. But sentence formation was little difficult. And then he was, by 1 year after the treatment, he was participating in school kids, and he was on stage. And then he can started understanding, oh, we are not going to grandfather's house now because they are not at home. Previously, it was not the case. He will go to the neighbor's house and bang the house door for hours together without understanding there is some privacy, there is some space between us and others. So he was not aware of that. So those things he started understanding, and he could understand the differences between the types of food. And now he is in a regular school. He is in high school, and don't you think he received calcareous phos-10M and also carcinosinum 30, and after that almost he started improving like anything except for few doses in between. So I think this case he had repeated fevers actually. Any weather change he will have fevers. He had fracture also once, but even though he had many challenges health wise, he didn't regress. He didn't go back to the original problems we faced in his 4 years of age. So don't you think this is the moderate challenge type of case where few doses of homeopathic remedies can cure the kid? He is a near normal child with very less autistic features now. Only little gap he has. And then broadly affected, these are all the very severe type of cases, including developmental delays in social and communication difficulties and repetitive behavior. This I will be handling in uh, teens and adult cases, teenage cases. So, what is the first step in evaluating cases? As we know, psychologist report, psychiatrist report, discharge summaries if available. That is very essential. As we see in the two uh, previous case witness, school reports, and yeah, this also we saw, and previous investigation. And then second step is in-depth case taking. So case taking format is available with IHRC has developed that you can avail it. And case taking, we know all these things has to be meticulously taken, especially for the growth parameters, head circumference in very small kids. So they will have bulky heads, especially in autism kids. We can see bulky heads by 3 years of age. And then uh, general examination, if there are severe skin conditions, they may be having comorbidity of ASD as well. And neurological cases. Yeah, I want to share one case with net here. You tell me, please put in the chat box, or if it's allowed, you can even unmute and speak. Uh, Dr. Nikita, you have to tell, is it possible to unmute and speak, or it's better to put in the chat box?
It's better to put in chat box, ma'am.
Yes. Please, doctor, put in the chat box. See, I am giving a case scenario. I treated a one child of 9-month-old. His problem was behavioral issue. He was so angry. He gets so angry that he will tighten his fist, he will shout, and he will shiver, and his eyes will go upside, and he will faint. Okay. Oh, what do you think about? Is it a behavioral issue? Only that? Yes or no? Yes or more to it? Seizure. Yeah. Yeah. Seizure like. Correct. So after that, I came to know that he started this seizure since few months, and then anytime something is taken away from him, they took away something, he will have that seizure. Uh, Once he had whole day he had the seizure, like from morning till evening, whole day he had the seizure, and it was he was affected with fever also. He will get the seizure, and he was treated for that with a local doctor. When the fever reduced, it got reduced, but that there was repetitive seizures, even though without fever. And then they got a CT scan and EEG as well. Not CT scan, EEG they got, and there were spikes in the EEG. Spikes means, if you are not aware, I will be telling you. If there is a positive spikes in the EEG, that means there is some epilepsy type activities going on in the brain, and it is usually a red flag. It is not essential. It should not be there. Yeah. Even without spikes also, a few kids will have seizures, but they are better. That is functional. But if it is spikes are there, that is we have to investigate more. So he had spikes. Yes, it is neurological issue. And then I will tell you more about his past history. He had once, that is 1 or 2 months before, that is seventh month, while playing, he fell head upside down into a basket. Okay. He didn't receive much injuries. After that only, he started developing this uh, seizure, a seizure-like episode. But it was told as breath holding. He will hold the breath and he will faint, becoming blue. Okay. But they are actually seizure activities there. And then when you see breath holding spells, they are usually they have no other spikes or anything in the EEG. EEG will be completely normal. But in this case, it was there was spike. And then I gave him OPM for his status epilepticus. I consider that rubric status epilepticus because whole day he had that seizure activity. And then he was better for almost 1 month. And then after I came to know that he had fallen down, I gave him arnica. He improved very well. He had very rarely few episodes, but that anger still there. Anger didn't go away. And then uh, now I will add you more things. Like his mother was very upset when she was pregnant because her husband had no job. Her husband's side's relatives are very, very uh, conventional, old fashioned, whatever you can say. They used to taunt her and they had made her life miserable. Even though when that kid was born uh, and he developed these seizures, they told her to abandon the child, send it to a orphanage because he has autism. So such was the type of situation during pregnancy and also after the child was born. So this gives you more clues, right? And then my question is, do you find any potential of this child developing autism spectrum? Yes or no? Little quickly, yes or no? Do you find any potential that this baby will develop into autism spectrum? Yes, we can see the potential here because the factors, marital factors, maternal factors, baby's history of head injury, his behavioral issues. These are all showing that he may develop some issues related to autism, probably. So, after the treatment, now he is in normal school, everything normal. But he is little angrier. He's angry young boy, isn't it? I had another case also where a breath holding spells in the baby, same thing, but he had no head injury. That child improved with belladonna and calcarea carb, same medication. See, even I want to give rare remedies, but sometimes it does not happen. We have to go for regular remedies, isn't it? Yeah. So these are all about case taking, and I think you all know about this. I will usually go with caregivers or parents version first, and then I will see the child afterwards. Because you have to take care of your clinic things also, because most of the kids will spoil things on your table, or they will even uh, put them on the floor. They will even break the bottles. Be really careful if the child is arriving with ADHD. These are all case taking formats which will be very helpful. You please go through with these things. I'll be sharing in the group. So these are all the all these developed by CDC or USA. CDC. And these are all guidelines also, how to go about the cases, how to tackle the case. So and I will this case Vignesh, I think you will be knowing that few things have little more specific focus, like especially mother's mood and mother's nature. If you come across such mothers, you can guess there will be some focus of autism in the future, because as per just syndrome is very elusive. You can't make out till 11 years. 11 years also, very less people get the diagnosis. And everyone will be blaming the parents for not bringing up the child properly, or the blaming the child for not behaving properly or not studying correctly as a neurotypical child, or not doing that, this and all. They don't know the reason, but they will be blaming. But if we can see, get oriented towards uh, detecting them very early. So these factors will help you to suspect, just like Sherlock. Oh, there is something big. We have to tackle this. Mothers of autistic child have less parenting competence. The thing is, they themselves are usually very rigid. They can't think out of the box. They want their child to be optimal, best child in the world. Okay, their expectations are too high, and I found most of the many mothers are like carcinosinum. They're too yielding or too aggressive, too yielding, and they give too much in everywhere, and they take care of the child like anything, like दम घुटता है child का, उसको उतना lots of things. He has to do that, this, he has to go that, there, 5, 10 things he has to do. And they're not, nothing is enough for them. So, marital satisfaction, that is their very, they'll be very complaining type of mothers I have seen, or very, very yielding mother. And family cohesion, less family adaptability. mothers of both autistic and Down syndrome children are being disrupted in planning, caretaker burden. They can't handle the difficulties of family burden and using self blame. Self blame. That is very, very important. When a lady is having a child comes with to you with some problem, if she is blames herself a lot, you see a red flag, you tackle both the mother and the child. Strategy than did mothers of developmentally normal children. Yes. And then these are all the maternal factors where advanced age. I will tell one case vignette here. You tell me whether this child will be a potential autism kid or not. One baby of almost around 3 years. She's such an intelligent girl. She's so talkative. She will be talking when she comes to my clinic. Totally, she'll be talking. She will stop her mother and father, and then she'll be talking. And then 3-year-old mother came to me for a child's behavioral issues. She will throw a tantrum. Mid of the road, she will sleep and she will be uh, hitting the ground and she wants something, you have to give her. Otherwise, she will not leave. And this has been very frequent, very frequent. Wherever she goes, she will do that. And she wants this and that, all fancy. And then, so do you think this will child will be a autistic kid? At this point, no. And then I will add, she had repetitive hospitalizations for her pneumonia till 3 years of age. She had been to hospital many times, and almost near death, like very emergency case. For that also I treated, and she got out of that problem. Uh, and then, so this is little red flag, right? And she has been on antibiotics a lot. And then her mother late married, and she conceived around 36 years of age with assisted pregnancy. She got treatment and then she conceived this child. So she was born around 36, 37 age of her mother. So maternal age, isn't it? And then there is when her husband used to come, he'll be very critical about her wife's weight. He'll be openly shouting at her in front of me. And the child used to get upset actually. Or she'll be like she won't hear what her father is telling to her mother. But definitely she will be planning for another time. See, so that is one coping mechanism for the child because she can't take the, she knows how to get the things done with her tantrum. Now you tell me whether this is a potential case for autism spectrum, yes or no? What do you feel? This is a 3-year-old child, all milestones normal, all other things normal, but yeah, you think it's not a potential case for autism? Yes, I guess so. I hope so. And I think she'll be in the normal group only, even now, neurotypical group. But two, three things, if we consider mother's late pregnancy and uh, her repeated antibiotics history, without homeopathy, he would have landed up in few things. It's not genetical or any other thing, but probably ADHD or some other behavioral problems she may have ended up. And also, she had hypothyroidism at this age, and she was on medication already, that child. And she had some developmental problems. So now, uh, but whatever Dr. Halloween is saying, yeah, I agree to that. She may not be a potential autism kid, but she is helped with homeopathy, and I hope she will be normal, neurotypic. But she may have other behavioral issues and other things. Yeah. These are all the natal problems or natal issues like abnormal presentation, preterm birth. Yeah, here I want to tell about one baby. She was when she came to me, she was around 11 months, 9 months old, 11 months old. She was dull and sitting there. She was not very active. She will sleep only in the day, not in the night. And her parent, one parent is working. Her father will be sitting with her whole night and he will sleep in the early morning. Her mother will take care from early morning. This was a routine for a few months now. And that child was dull. They thought her cousin was, one of the cousin was diagnosed with autism and they were afraid that this child is also will be put in uh, autism spectrum. So when they came to me, I assessed the child. She was looking at me, but she didn't respond to name calling, and she was slow. But she was responding to her father's command. When he called her name, she will respond, not to me. And then she was not interested in me. And then she was interested on the things on the table. She will take the things and she will drop them on the ground. She want to lift it. So after all these things, I considered, I asked her further, and they told she was preterm, almost of 2 months, like 7 months complete. She was born because due to some complication, and then there was some cord around the neck. After that, I told them she is preterm birth. She is in. She is now not, even though she is 11 months old at this point of time. She has developed till the age of 9 months only, and she is a neurotypical child. Don't worry. I gave her medicine, and then she started sleeping at night, and she is such a wonderful child, such a wonderful child. Now she dances, sings. Now she is 1.5 years old, 18 months, and she has to develop speech yet, but she walks around, dances, and she is very, very uh, normal. So preterm birth has so much of impact, and even summer birth, and those who are left-handers. So we think of small, small things, but they have so much of impact. That's the point here. That's why I'm talking about these things. And postnatal factors like jaundice, low birth weight, and encephalopathies, early infant infections like meningitis that we saw in that case, right? Lack of breathing and infant resuscitation. These kids will be in the broader group who have very, very severe consequences. And weak or no crying after birth. So I will make it little faster. So these are all I will share in this PPT. I will share in the group. You can see them. Uh, it will be helpful. You please preserve these things. I have developed these with my efforts. You will find most of them in the online, but not this fact. And then these are all the milestones. We have spoken about all these things. Not imitating others, not treat people like they have no interest. And then remedies I am not talking about today. So these things also have spoken about like genetic liability to autism as indexed by borderline autism phenotype features is equally elevated in families of children with and without language regression. So that we saw in that case, right? Rett syndrome. Purely environmental explanations cannot fully account for regressive autism. Yeah, but high fevers, yes. But when there is neglect, that cannot account for regressive autism. They won't usually regress, but they will have autistic features. And the environmental factors may instead act as a second hit atop an existing genetic vulnerability. So, if they are genetically having autism features, they will have secondary environmental conditions will make it worse. And currently, epigenetic and its complex mechanisms are presented as the most momentous mediator in the environment and genome interactions. Environmental factors can affect the quality and quantity of gene expression without changing the DNA sequence. So this means homeopaths have the highest level of potential to help autism uh, diagnostication. Why? Because there is very strong evidence that homeopathy, when introduced, has modification of epigenetics, and actually it can even have genetic modification, but not the deletions and chromosomal abnormalities that we can't be that we can manage, but we can't treat them, or we can't make them normal, isn't it? They are very grossly affected individuals with chromosomal abnormalities. But where there is epigenetics involved, just like the three categories which I already spoke about. So we have the highest level of chances of helping autism kids. And whatever I shared are the ways where we can catch them very early. We can detect there is something going on, something wrong is going on. If we treat them at that stage, especially below 5 years. And another case, that one child of 4.5 years, he came to me. He was non-verbal, and he had skin infection, which he contacted from his brother, and improved very well with zinc. But the thing is, his mother vaccinated him again, and then he regressed completely to the original state where I had started. He went back to that state again, and then I don't know why, what is preventing them to take homeopathy again. She told she is taking homeopathy from another doctor. I don't know that. But the child is non-verbal. He's no sitting tolerance, no improvement is in milestone. He is way beyond his age. Now, say 7 years, but he is still at 4.5 years age. Mental development, not even 4.5, still less. So, what do you think? Isn't it parents? They didn't explore the whole thing of homeopathy. Do you think so? So, so these are all the ways I want to make you oriented so that you catch them young, and you know that the age. So the ages of below 1 year, or toddlers of 2.5 years, they have achieved almost near normalcy with homeopathy, right? And child with 4.5 years or 5 years old, that age group, little difficult. So they can be made near normal. Somehow it didn't happen. But above 7 years, it's very difficult. We can only manage them. Unless very rare cases will have cures, as far as my experience goes. But about 10, uh, no, very, very less. Not very hope. But definitely homeopathy has a very good important place in managing their behavior, tackling their mindset, orientations, and even other things. We can improve them a lot. And I can say only homeopathy is the best thing for ASD kids, along with all the treatments they are going on. So these are all the things which are along with autism, co-occurrences. If we are aware of these co-occurrences, we can handle each of them what they need. Like behavioral issues, along with homeopathy, we can send them for therapy where their behaviors will be changed. And they have trainings, they need toilet training and other things that has to be tackled, ADL. And they have to be counseled for their anxieties and fears. And they look like a very bad people when they are in a meltdown stage. So we have to we have to know that they are in the meltdown stage, and they have to be given therapies suitably. And psychologists are the doing best in this area. They are pulling off very good results in helping autism kids. So not just homeopaths. So we can be homeopaths can be in the team of psychologists, psychiatrists, social worker, and speech therapists, occupation therapists, and those help with investigations and help in our diagnosis. So we can be part of this bigger group, and we can pull for magical cures maybe, or even magical things in autism spectrum kids. And that is the purpose of this presentation. If I could orient you in this, and that is the role of homeopath, and it is very, very promising, very, very promising. If we have this orientation, we can help the kids as well as the parents. And if we showcase the results, what we are getting through, that will be very great for the whole world. With this, I have already shared case vignettes. I will share case vignettes of a few other according to the age group in next this thing. I hope I shared the all cases I had thought of. One second. So did I take too much of time? Yeah, 4.5 years. Another case. The child was non-verbal. He was humming, always humming, singing his own world, and his mother had. See, I think time is. I'm taking much time, so I will make it a little faster. So that 4.5 year child initially came for no appetite. His grandfather brought him. He'll be always biting his lower lip like this. That means he is anxious. Usually, your parents will be telling at home. If the child is biting the lower lip, it is not a good sign. They have some health issue. So that one struck me when he was always biting his lower lip. That means he was anxious, or he was uneasy, something. And he improved very much with lycopodium 60. And then he started talking one or two words. His grandfather used to bring him when he was 4.5 years. And then his mother was treated for her OCD, and she had lot of emotional issues, and she had problems with her in-laws, and she was in the verge of uh, very breakup and all those very big things. And she thought she was not supported by her husband in a way she needs to be supported. But the thing was, when we see as an outlook from outsiders look, the thing is she was very dramatic, and she was too much of she was asking too much of attention. It seems so. The thing is, there is disharmony, disharmony, and she improved very much with Ignitia. Ignitia 30, she could get the insight that family is important. She has thought out the problems, and she has to be good with in-laws as well, at least outsidely. Outwardly, she has to show that she is good with them. She has to handle her husband also, because he is not a all these things he sorted out. But here she was treated with the psychiatric reps in her uh, pre-pregnancy and during her pregnancy, first trimester. That could have some impact on the child. And now also he is in the special. And guess what? I feel he would have been a normal neurotypical child if he was continued homeopathic treatment. Do you think so? If he stopped then only, that is in 2016, he used to come to me. After that, nobody brought him to me regular. Do you think he would have been neurotypical child if he continued with homeopathy? Yes. I hope so. But that's why. And uh, now you tell me, what do you think when the case is not improving, or we are not seeing there is no response from the child as expected? Do you think it is doctor's fault alone, Mipa's fault alone? Please reconsider your thoughts. Don't you see that parents also have a very big role? They are not bringing the child as expected to the therapist, I mean homeopath. They are not continuing with the treatment as expected, right? So, and many more factors are there. We will talk about them afterwards in the uh, next week. Thank you so much for this great opportunity to me given to me. Yeah, I am open for all the suggestions. Please send your thoughts on WhatsApp. If it is not allowed on the group, you send me personally also. Will would love to hear from you. What type of presentation you want next week on the subject what I have chosen? Please share your thoughts. Thank you so much for the opportunity. And pardon me if I have crossed the time limit. Thank you.
Do doctors, please, do you have any queries? If you have any queries, you can put in the chat box. So ma'am, I hope so. Let me conclude the session with I'm taking this opportunity to thank our respected faculty, Dr. Rega Kannam Srinivasan, for this wonderful session today. Your session was truly insightful and has given us valuable knowledge and perspectives that we can carry forward with our cases too. And I also wish to thank all the participants for your active involvement, thoughtful questions, and enthusiasm throughout the session. Your presence and participation made the class more engaging and meaningful. A special thanks to the organizers and support team who worked behind the scenes to make this session smooth and successful. Once again, thank you all for your contribution. We look forward to many more such enriching learning experience together. And one more thing, on September 16th, we are having the continuation of this session by the same faculty. So be on that day. So thank you, ma'am. And once again, for all, good night.